Thank you so much for joining us. This is a TDR Live this Friday evening, December 27th, 2024. Please like the live stream. If you have not subscribed to our channel, please do so as well. So unfortunately, we have the wrong thumbnail on on the channel, but this is the correct thumbnail here. The 69% blame health insurance companies for UnitedHealthcare CEO murder, Brian Thompson. So we're going to go ahead and take you to a clip here from Breaking Points. This is a kind of like a left-right wing YouTube channel. He's not that right, but Sagar is the commentator on the left, and the commentator there on the right. Good Lord, I'm forgetting her. I'm having a brain freeze at the moment, but let me see if I can find her name for you. So she's the one who presents the left-wing kind of point of view on this program called Breaking Points. They were formerly anchors or commentators on The Hill Rising, and their name is not even appearing on their channel. They should put their name on their channel here. But let me see if I can find out their Crystal. Right, Crystal. That's her name. And Sagar. So Crystal's the person on the right there, and Sagar is there on the left. And they had a segment on Breaking Points about a week ago, talking about the alleged shooter Luigi Mangione and the public outcry against UnitedHealthcare for their shady practices, like we talked about before. And the focus in this segment was really about what the public reaction to it. And Sagar had some comments to what was basically being reported as universal support for Luigi Mangione, and he was pretty much skeptical that the things that appear on social media are actually really indicative of how the public sentiment really feels about a given issue. But let me see if I can find the actual date here when this came out here. So this was, and this is just taking a long time to load. So I believe this was on December 16th, 2024. And so they're going to start off here with a clip from Fox News, I believe, here. So we're going to go ahead. Yes. So this was on December 16th, 2024. So we're going to go ahead and listen to the clip, and then I'm going to go ahead and now remember, this is December 16th, so to be fair to Sagar, he didn't have this information that just came out recently today. A new poll was conducted by the University of Chicago. So I'm going to go ahead and listen to this clip right now.
Particular, those extraordinary segment on Fox Business where they took great issue with the comments that both Bernie Sanders and Elizabeth Warren have made, basically saying, listen, of course, murder is wrong. We all know that. However, you have to understand the public reaction and how they see the healthcare system as itself being violent, cruel, and evil. In response to this Fox Business, I guess, what is Joe Concha, a contributor there?
Concha?
Yeah,
he's like a media
contributor.
Yeah.
Anyway, media critic, whatever. Analyst was brought on to call for their resignation over these comments. Let's take a listen.
This absolutely makes my blood boil, Liz, and I'm sure that's true of anyone sane and sober who advocates a civil society. These are, including Elizabeth Warren, Bernie Sanders has had the same sentiment. 2 U.S. senators that we're talking about, they've been in office for decades, and they think that shooting a father of 2 boys, a husband in the back like a coward on the street, like this 6'6" person, Luigi Mangione did last week, they're saying that what? Brian Thompson, the CEO, had it coming somehow. Both should resign from the Senate for this rhetoric. They are begging copycat killers to come along and start taking out other CEOs or anybody in a position of power whom they disagree with or whose industry they disagree with. Every Democrat on Capitol Hill should be asked if they support or condemn this ridiculous, reckless rhetoric. The same kind of rhetoric, Liz, by the way, that Democrats use that nearly got Donald Trump killed twice, including once on national television. I mean, look, I thought that Obamacare was supposed to bring down the cost of health care and premiums, and the opposite has happened. Are we going to hear criticism from Elizabeth Warren about the architect of Obamacare or the president it was named after? Doubtful. Liz Warren and Bernie Sanders should be shamed into oblivion for this, as should every member of the media, by the way, that is turning this lunatic into a sex symbol. It's nauseating as a father, as a human being.
So to state the obvious, analysis of the public reaction is not the same thing as advocacy for murder, quite clearly. Number 2, hilarious for Republicans to pearl clutch over violent rhetoric when, of course, Donald Trump was out there like calling for the military to be turned on his political enemies. Number 3, the idea, Sagar, that Bernie Sanders in particular, but also Elizabeth Warren, haven't been critical of Obamacare is kind of preposterous. And number 4, there's a later part in the segment, which it was like a 5-minute segment, so we don't want to play the whole clip. It's just too long, where he starts going off on AOC too, and he's like, why don't these people offer solutions? It's like, they literally have been offering you may not like their solutions, but Medicare for All is a solution that they have been pushing for, Bernie Sanders in particular, for probably literally decades at this point. So whole thing is just fake outrage over, what has been a mass reaction against the healthcare industry in the wake of this killing.
So I think there has been a mass reaction. I think I guess I'm just starting to get skeptical that this is, having lived through some leftist, justifications for violence and others, there generally seems to be an overestimation of, quote unquote, how much the public is with you. So just because something is viral on TikTok or elsewhere, I mean, BLM was viral on, not TikTok, social media or whatever at the time, but people publicly turned against it. So I'm not saying that the, quote unquote, rage and all of that isn't there, but I also am a little bit skeptical that people are full blown like, yeah, I'm actually like genuinely happy that this person has been killed.
Oh, I'm not saying that.
Okay, but for example, there's this theory like you just laid out that people are like crying out for universal health care. But if you look at the statistics, I mean, the vast majority of people are, quote, okay with their own healthcare plan or coverage. I don't agree with that. I think your healthcare plan coverage and et cetera is way too expensive, is bad. People mostly have affinity for their doctors. I mean, a small portion of the US public, some 30 to 40 million, is genuinely like destroyed by the U.S. healthcare system.
Yeah.
I think those are the people who probably have been speaking out against this. But I also don't think we should overstate the case of like what all this is. Like if the people truly cried out for universal healthcare, I think they would get it. And I just genuinely don't think that.
You think we live in a democratic system where people get what they want when they support it popularly? Because that has not been my experience. I mean, if you think back even to the 2020 primary, right? Bernie Sanders.
So we're going to stop right there. I mean, he just said that, if the American public wants something, they get it. And this is just not true. If you go back to the founding, and actually I should have created a slide of James Madison's Federalist 10. So the Federalist Papers were a series of articles written in New York in support of ratification of the U.S. Constitution in 1787. And Federalist 10 basically said that the whole aim of the Constitution, or the whole aim that the Federalists had, was to basically limit the influence of factions that create divisions within society. And one of the factions that the framers of the Constitution, like Hamilton, Madison, and John Jay, considered nefarious was basically the people who didn't own land or people who had debts, basically the majority, they saw the democratic influence in society as a very nefarious faction within society, very dangerous, and it had to be regulated. So the whole point of our system really was to create competing factions according to Federalist 10, so that the overwhelming majority would not get really what they want. Because if we had a democratic system from the very beginning, then those who did not own land, the framers feared, would steal the land from the landed aristocracy of this country. Those who, who were had debts would oppress creditors in this country, and so forth. Basically, the underclass would rise up and take power, democratic power, from the hands of the oligarchy at that time. And they didn't want that. They also didn't want the reverse. They didn't want a system where, the elite would be in charge of everything. So that's why they set up the different factions, and they set up the system where the members of the House would be elected directly by voters, not by the people, because they left it up to the states. So it was up to every state. Every state was basically given the power to basically pass laws that made creating voting rights, creating laws that allowed people to vote. So some states had requirements that you had to own land, or you had to pay a certain tax, or so forth, at that time. So every state had a different requirements for voting. So they left it up to basically in the House, they left it up to the will of the voters at that time. For the Senate, they left it up to the state legislatures. The state legislatures basically chose the senators. And that ended during the Progressive era, which was there was a period in our history where the Constitution was amended so that the voters would directly elect their senators. And then you had, during that period, also women were also granted the right to vote. And the president would, of course, be elected by the Electoral College. So that was the whole aim from the very beginning. So from our nation's history, from 1787 all the way to the early 1900s, there was really the only democratic voice that the people had was inside the House of Representatives. That's it. And as all of you well know, you can't pass a law without a bill passing both the House and the Senate. And then you can't pass a law without both the House and the Senate agreeing on the final version of the bill, passing it with a majority vote, and then sending it to the president and hoping that the president doesn't veto the legislation. And then even if a law is passed, you have in recent history the Supreme Court weighing in whether something's constitutional or unconstitutional. So this thing about that if the American public wants something, they'll get it, is not borne out by the facts. It's not borne out by history. So even during the New Deal, FDR had a very difficult time getting his program passed, because he had the Supreme Court meddling in a lot of his reforms, especially the I forget the name of it. It was the NWA, I believe, the National Workers. I forget what the A stood for, but they were in the way of many of his reforms. And even though he had a majority in both the House and the Senate, an overwhelming majority, and he was elected by close to 60% of the vote when he was first elected. So even in that instance, when the American people wanted more reform, even more radical reform than what FDR was offering, they couldn't get all of FDR's New Deal programs passed. So this is completely, people from the right wing just sometimes, I like Sagar, as he seems like a nice individual, but that's what he just said. It's just not borne out by the facts. With all due respect to him, I don't mean to come across as rude to him. So it is not true that if the American public wants something, they're going to automatically get it, because there's so many hoops that the system has that makes it difficult for the democratic will of the voters, or even the democratic will of the people living in the U.S., to pass. Even passing a bill, so a bill is introduced, gets marked up by a calendar. It could be killed by, depending on who the Speaker of the House is, they can mark it up on the calendar. They send it to a committee. Then the committee starts working on it, and the committee does their own version. They hold hearings, and they bring experts and so on, and they report back to the House, and then they basically have their own version, and then the entire House then starts debate. I'm paraphrasing basically the whole process, but within just one branch of government, just to pass a single bill, or just even not even to pass, just even to vote on a bill. Sometimes these bills, they don't even get a vote, or up or down vote. There's so many systemic obstacles for all of this to happen. So it's not true that if people want something, they're gonna get it. It's just not the case.
Sanders is running on Medicare for all.
Yeah.
Every poll showed that large majorities of Democratic voters, even in states like Mississippi, supported Medicare for all over maintaining the current system. However, they backed Joe Biden,
yes,
because they were convinced that he was the only person who could beat Donald Trump, and they were convinced by the electability argument. There was a recent polling, I think from Gallup, that showed the highest level in recent years of people saying that they believe it should be the government's responsibility to provide for universal health care.
That's not the same thing as Medicare for all, though, and that's the
but I'm not saying exactly, but I mean, that is a commitment to, this should be a human right. Healthcare should be a right and not a privilege. And I do think, even if you look at the polling in this election, neither candidate ran on healthcare. I mean, outside of like, oh, we're going to lower a few prescription drug prices or whatever, that was it. Healthcare has been completely excised from the national political conversation up until this moment. But even with that being the case, with neither political party really pushing the issue, you still had people ranking healthcare reform as one of their top issues. Right. It clearly is a system that causes a great deal of pain. Now, you're right. Do you want to take, what happens on Twitter as always real life? No. But the fact that you had this same reaction across every single platform, I think definitely tells you that there is some there. And there was actually polling that came out, we didn't include it in this segment, but some pretty extraordinary polling, especially of young people, where Luigi Mangione, the killer, has a higher approval rating than healthcare in the United States, health insurance companies, and Brian Thompson, who's the slain CEO.
I know, but this is part of the problem with the cherry picking stats. Like Congress has a 13% approval rating. 90% of people approve of their member of Congress, right? So the point is that it's complicated in terms of how it actually manifests.
So you think people are actually satisfied with Congress?
I think people like their congressman or delude themselves into thinking that their particular congressman is the good one. It's all the other bad ones that are it's like doctors. I've talked about this before. Everyone loves their doctor. Nobody wants to talk about why our doctors are wildly overpaid. Sorry, docs. I know you'll crucify me for that one.
So, he brings up a point there. It depends, because again, our system, what he doesn't bring up, the fact is there are systemic obstacles for somebody, a challenger coming in, defeating an incumbent. This is part of the problem of our electoral system. You have roughly a 90 to 95% incumbency re-election rate in the House, and I think something like 92% in the Senate, 92 or 95, somewhere around there. One of them is a little bit lower, but they're both above like 90%. This has traditionally been the statistics on incumbents getting reelected. Why do they get reelected? Is it because people like their congressman? Well, not necessarily. It's just that once you get elected to office, you have all these advantages. You have name ID, right? If you belong to one of the two major parties, that's a big advantage. If you're not a member of one of the two major parties, then you're going to have a tough time getting reelected, because major parties have vast resources that can help you get your name out there. Okay, so it's not people don't necessarily like their member of Congress. They might tell polls. So it depends on the poll, on how they frame the question. So you can't just assume that the American public likes their member of Congress, but they hate the other members. In fact, half of the electorate doesn't even vote, and in some districts, more than half don't even vote. So that's not even a sign of an endorsement from the public that so many people are just not even bothering to vote because they don't feel that the system really is meeting their needs. They don't feel that the system is really adequately representing them. The other thing is that if you want to run for the House, you need to raise roughly around $1 million to be competitive, right around there. If you want to run a competitive Senate race, then you need to be able to somehow raise at least $10 million. And a lot of people just don't have that talent to fundraise. So there's another obstacle, that our elections are just becoming even more expensive, and it's giving an advantage to the lobbyists to weigh in because they have vast resources that the general public doesn't have. So in order for the general public to really manifest their voice in the electoral system, they would have to pool all their money in the small dollar donations and support a certain candidate that represents their view. So his is a very cynical viewpoint because you're just assuming that they must like their own member of Congress. Some cases, yes, but and again, he could probably bring up a poll, but again, it depends also on how the poll how they phrased the question. And many people don't even know who their member of Congress is. There's been polling in the past done that I remember when Al Gore was vice president, about half of the public didn't even know who the vice president was when Bill Clinton was president. It was Al Gore. So if half the public, or around there, about half or 40%, if almost half the public doesn't even know who their vice president is, do you think they're going to know who their member of Congress is? So that's not, again, if the member of Congress was that effective, a majority of their constituents would know who that person is, and just a lot of people just don't vote in this country like they used to in the past. But we'll continue here.
Compared to every other developed country in the world. Like, this is the thing, is that if you actually dig into it and you look, all right, even coming back to the universal health care point, like you just talked about, the government has responsibility. That's not the same thing as a single payer system. Right now, if you look at faith in our medical system, public health, and others, after you've just gone through COVID, how could you want the government to take over universal health care? That's insane, considering the amount of bullshit that they talked and lied to us for over 5 years. If anything, America's become way more libertarian whenever it comes to health.
I don't think so. What about our fire department? Do you want our fire departments to be privatized? Would you want? He's assuming that everything that the government, lays their hands on, it's a mess. Well, what about our roads, our sanitation system, our public schools? They function. You don't see public schools, bridges, falling, and you see that a lot in the private sector, where a lot of private roads, where bridges are in disrepair, they never get fixed. You see more chaos in private health insurance companies, where they're denying claims, and it's not effective. And even what Luigi Mangione allegedly mentioned in the manifesto, that we spend the most in healthcare in this country than any other country in the world, and yet we're, according to him, he said 42nd in health outcomes. I think he's citing a World Health Organization data that's been done over the years about how effective healthcare systems are around the country. I think Sweden or France or some of the top countries, I believe, might have been Sweden or Switzerland, and Denmark tends to rate a little bit high, but they're all like Western European countries that have pretty much either a single payer system or something, both a single payer or a private system, but people, you don't have the system like in the U.S. where people are paying these exorbitant prices for their prescription drugs, or they have to go bankrupt to get a life-saving operation. That just doesn't happen in those countries at all. Those countries as well, their election systems, ironically, this is why elections are important. A lot of people on the left argue, elections aren't important. They are, because our system is not democratic, our election system, right? So in other countries, like in Western European countries, the political party that gets a majority, 50% plus one, they run the government. They get to pick the cabinet officers. They control both the legislature and the executive branch. That's it. And their program pretty much gets passed. In our system, you could have somebody winning the presidency, but then their opposing party might win a branch of Congress. So that's the situation we have right now with Joe Biden being president, yet the Democrats have a one-vote majority in the Senate, but the Republicans have the majority in the House. Nowhere else does that system exist in other countries, in advanced like Western countries. They just don't allow, and that system that I just described, the U.S. electoral system, is just, you're just inviting chaos and disruption, and it's not even the fault. People blame the politicians, but it's really your system. You haven't reformed the system so that it's more functioning. That's not a functional system. So our election system is partly to blame as well. But let's continue listening to Sagar here.
You want big pharmaceutical
This isn't about what I want.
with a
This is about how
for-profit
people are
motive, and
feeling.
health insurers with a for-profit motive. I mean, if you just look at our system compared to, listen, I'm not saying that every other country with universal health care where it's perfect and nobody has any complaints, but the cost is lower, the care is better, and people live longer.
I agree.
Like, it's very clear. And is it a universal sentiment in favor? No, of course not. But I think it's pretty undeniable at this point that this moment has struck a chord with people, because so many Americans have had some horrible experience with the healthcare system and do experience it as effectively cruel and terrible and inhuman. I mean, it's just at its core, like putting profits over actually caring for people when they're ill, making sure they get what they need. That is an immoral system that we have set up. And yes, I think that millions and millions of Americans experience it as such, and that's why they're reacting to it. So to, just like dismiss that, I just don't agree with that.
I'm not dismissing, I don't want to overstate it. I think it's trendy and it's cool right now to like talk about Luigi Mangione. And I get, look, it's funny, all right? Like, as somebody who's been on 4chan since literally a teenager, I understand dark humor, etc. It doesn't bother me, all right? Like, if anything, I'm laughing right there with you. But I'm not going to overstate the case as some sort of like mass social movement. I just think it's a lot more multifaceted than a lot of people who want quote unquote universal health care believe. Trust in government is an all-time low, trust in institutions. I mean, the vaccine rate is now basically like falling. I think the flu shot had the lowest uptick literally ever in modern American history. The number of people who are choosing personal exemption and are outwardly flouting government guidance is higher than ever. I don't even think any of that is necessarily a bad thing, because people are asking questions for themselves. But that doesn't comport. But that's not. But yeah, okay. Old people like when Medicare pays their bills, but they don't like whenever they get told what to do.
But that's what
mostly
Medicare
what it comes down
for
to.
all would be. It's not.
Okay,
That's what
again-
Medicare for All. That's
Right.
the proposal
And
for
Medicare
Medicare for All.
Advantage is a
Is just to
disaster.
expand Medicare, already a
work.
very popular program.
private system.
And Bernie's plan specifically
Blame
would just
Medicare. It doesn't
continuously lower the age until you have everyone covered by Medicare. Much lower administrative costs, much better outcomes. In line with what many other countries have done. So it's not like you're going to be going to like your government-issued doctor. Although I will also say
I
that
mean,
the
you do
VA
have to.
healthcare system is also much better than the private healthcare
You're
system
certainly
as well.
listen. I don't disagree about health outcomes, etc. I just don't think we live in a society that can tolerate this right now. I mean, I can talk about Japan all day long,
That
but
can
when
tolerate what?
that can tolerate like literal government administration, rationing, and so that like in Canada and the UK, these are baked-in social programs from World War II onwards.
People tolerate
75
Medicare
years.
just fine.
Yeah, people
They
tolerate
love
quote unquote.
they love Medicare
Again,
and
I
Social
think
Security.
they
I mean,
like-
these universal programs are very popular.
They like it when the government pays their bills. They don't necessarily like it whenever they're being told what to do or when they're rationing care or whenever we had, what was it? There was huge COVID outbreaks in a lot of these Medicare
So
nursing
what do you
homes.
think that the best solution would be?
Oh, if you ask me about solution, I think we should have universal coverage, not necessarily single payer. I think there's certainly every American should have access to low-cost health care, but a lot of people will not like what it takes to
Is
get
that
there.
like a public option?
I mean,
or what
I'm
do
not
you-
really sure. I mean, really, it's about democratic because the point is that we need to have sure that people have coverage. We also need to break up and destroy a lot of the cost vectors, which is private equity hospitals, which is doctors, the American Medical Association, the fact that our people are getting 5 times more salary than the average doctor
It's
in
just-
Europe. It's
sometimes
outrageous.
I feel like there's a treatment of the American people as if they're this static entity that have their minds made up, and we just have to like analyze what that is, and in reality, people are very like their minds change and they're persuadable, and when an event occurs that causes them to think about the healthcare system differently, they change their minds and they open their minds to new possibilities. I mean, previously in the early.
So then that brings us to this article here from Rolling Stone, and actually, this was brought to my attention. Actually, I received emails from Clem Klippenstein, who sends out emails to, I guess, his subscribers on Substack, and he cited this poll that was conducted by University of Chicago's NORC. It was a survey, and so we're going to go ahead and take a look at. But the discussion that we just all listened right now. I mean, really, I think in this country, people just take for granted. You just think of our fire department. I mean, what if that were privatized? Would you want our fire department to be privatized? Because he's arguing, when you leave things up to the government, that it's just chaotic. Well, not our fire departments are like, our police departments, they run pretty much. I mean, they kill a lot of innocent people, but I mean, they're there. They're just, you call them, and you when you need them, and you can call them, and they'll arrive at your house usually, and in some cases they arrive soon. Our public school systems, we don't have the best outcomes, but again, just because we don't have the best outcomes in the public schools, you can't blame really teachers or principals. That would be like blaming doctors for people being obese in this country. But look at our public school systems. They function. They've been functioning throughout our country. You have very good public school systems. The ones that are funded, that receive very good funding, tend to do very well in our country. But yeah, you look at the sanitation system in this country, roads, the Interstate Highway Act that was passed in the 50s. They've been functioning. I think the government does do things well. Our military is run by the government. It's not privately run. Though Bush tried to privatize it with these no-bid contracts for favoring Halliburton, because Dick Cheney was former CEO of that company. But and then she just mentioned the VA. People love the VA. People who basically have had received care in the Veterans Administration. Medicare is very popular, so Social Security. And when you see this, when Democrats and Republicans like Bill Clinton or George Bush try to even attempt or even think of reforming Social Security or Medicare, cutting it, they receive like a public backlash and they back off. And even Barack Obama, who tried to do something similar as well. The public just does not want their politicians to touch Medicare and Social Security. So and they've tried this. They've tried schemes where they want people to be able to use their Social Security benefit to invest in the stock market. Bush wanted that scheme, but he couldn't even get it passed. But yeah, this was the article from Rolling Stone magazine, and it says here 69% blame CEO murder on U.S. healthcare system. So we just heard from Sagar that he was like skeptical. How much is this public outcry on social media? How much is it really indicative of how the public sentiment is on this issue? Well, you have this article here that just came out on Rolling Stone. Many Americans blame insurance profits and claim denials for CEO killing. Poll. New poll finds most Americans partly blame health insurance companies for the murder of UnitedHealthcare CEO Brian Thompson. So there you have it. I mean, you can't deny the evidence. Most Americans think that healthcare insurance profits and claim denials played a role in the murder of UnitedHealthcare CEO Brian Thompson, according to a new survey by NORC at the University of Chicago. This Rolling Stone article reads, since his killing on December 4th, social media users have repeatedly expressed their anger with the health insurance industry and thirsted over the person charged with the crime, Luigi Mangione. Evidence suggests that the killer's motive was related to the health insurance industry. According to law enforcement, the words delay, deny, and depose were written on ammunition from the crime scene. These words appear to be a reference to the health insurance industry's playbook to avoid paying for health care. Delay, deny, defend. The NORC poll finds a staggering percentage, says here, of Americans attributed Thompson's death, at least in part, to the health insurance industry's business practices. 69% said that denials for healthcare coverage by health insurance companies bear a, quote, great deal or a, quote, moderate amount of responsibility for Thompson's killing. 67% said profits made by health insurance companies played a great or a moderate role in his killing. And goes on, this is more broadly, about half of Americans said that wealth inequality played a great or moderate role in his killing. So this is an issue here where the right in this country does not want to talk about. They don't want to talk about income inequality. They don't want to talk about the rate of CEO to the average worker pay, that CEOs today make over 300 times more than the average worker in the companies that they run. Okay? Brian Thompson made over $10 million last year and owned millions of dollars worth of stock. He owned so much stock that he sold about $50 million worth of stock before a federal investigation to his company's practices came out public. So he had been allegedly accused of insider trading as well. So yeah, 11% said that the individual committed the killing played no role at all in the murder, while 9% said a little. However, 78% said that the shooter played a great deal or a moderate amount in the killing. So yeah, so the 78% do say that, hey, he's the one responsible. He did pull the trigger after all. right? So, um, so there you have it. Oh, sorry, I read the wrong one. So more broad, let me go back here. More broadly, about half of Americans said that wealth inequality played a great or moderate role in its killing. Thompson made 10.2 million annually. Younger Americans, according to the Associated Press, were more likely to believe that multiple factors contributed to his killing. It's not just one thing. And what I just read previously, more broadly, about half of Americans said that wealth inequality played a great or moderate role in his killing. Sorry, my bad. Somehow the poll found a significant number of Americans think the killer played no role at all in Thompson's murder. 11% said that the individual who committed the killing played no role at all in the murder, while 9% said a little. However, 78% said that the shooter played a great deal or a moderate amount in the killing. Like I said before, he did, after all, pull the trigger. Then you go on, among those who reported having issues with their health insurance, 43% said they had to pay for some or all of the related healthcare costs. It's almost half. 28% said they were unable to receive recommended care. And 39% said the issue had not yet been resolved. So this is the outcomes that our system really does not provide to our people in this country. 7% had no health insurance at all, which makes it even more difficult for people to receive necessary care. So yeah, that's about it, folks. That's the article, and so here is the actual poll, the findings in that poll that were done, and then the question here is, how much responsibility do you think each of the following had for the recent killing of the UnitedHealthcare CEO Brian Thompson? Now remember when I said the phrasing, right, of the question. So of course Luigi Mangione he pulled the trigger, right? So the question does not ask, do you support really what he did? In this part of the poll, it's not asking that. It's just asking who's responsible. And you have the results right there. Denials for health care coverage by health insurance companies. 44% said a great deal. 24% said moderate amount. Look at only a little. 15%. None at all. 14%. If you go to the right. Now, the none at all, having no responsibility at all, if you go down, says personal issues in the CEO's life. So, and then the second one, health insurance industry layoffs and job losses. So wealth or income inequality, 24%. Profits made by a health insurance company, 67% say a great deal or moderate amount there. It says that it's their profits, and then 69 the denial claims. Very few people think that it's not that reason. Political divisions in the U.S., almost half say yes, it is. Only a little and none at all, it's the 53% actually. So there it is. The individual who committed the killing. Only a little, none at all, 20%. That's kind of staggering. That is very significant. That 20% of those polled here, they're not. They don't really think that Luigi Mangione is really. That he's really that significant of an actor, right? He's just an individual. But because people understand in this poll that it's a systemic problem. I think people get that it's easy to point blames at the individual. Like this segment, and that segment of the Breaking Points, the Fox commentator was pointing fingers at Elizabeth Warren, Bernie Sanders, and then the shooter. This is not really about individuals. The American public understands that this is a systemic problem. And as I laid out before, the systemic problem is our election system is part of the problem, our lobbying, our politicians unable to pass laws effectively, our undemocratic system in our government. And like I said before, the lobbyist influence really corrupts our politicians who are in Congress. We have a for-profit healthcare system that incentivizes companies really billing the government, especially Medicare Advantage, and incentivizes providing less care for its customers. In case of UnitedHealthcare, a third of their customers receiving almost no care at all. So that's, and why do we have that system? Well, they have very effective lobbyists, and they sponsor many of the mainstream media's programs. So you won't. Why aren't you hearing this information in the mainstream media? Well, you do hear it, right? But it's not a narrative. So they'll put it out an article or maybe do a segment on it, but it's not going to be a part of the prevailing narrative for a week, right? Because the mainstream media receives advertising dollars from corporate America, and especially the health insurance industry. They take out ads in cable news, or there's even in social media. There's just ads everywhere. The newspaper is a lot. It's really run by ads. Our newspapers could be free if they wanted to, because they could rely on advertising dollars. But that's the problem, that when you have media that's reliant on advertising dollars, well, then that media is going to be careful what they report, right? So they will self-censor, because if they don't, then they run the risk of losing those advertising dollars. But yeah, so there it is. I mean, so Sagar, I think that's how you pronounce his names. I think that was mispronounced from before. He was skeptical, right? But now, we have more evidence now about public sentiment, that really what we're seeing on social media really is painting a pretty good picture of what the overall society feels about our health insurance companies. And it's a very negative picture on our health insurance company. And we went back. If you've gone back to our previous live streams here, you will see that even on Brian Thompson's LinkedIn account, people showed up to his LinkedIn account and commented on his post, telling him, bringing to his attention how his company denied care to a loved one, of theirs. So even that was telling. There. Thank you so much, folks, for watching our live stream. This has been a PDR Live. We've been talking about this. 69% of the American public was polled in a recent University of Chicago poll blame health insurance companies for the murder of UnitedHealthcare CEO Brian Thompson. Please like the live stream, subscribe to our channel. This has been the PDR Live. Thank you so much for joining tonight. Have a good night, folks.